Great day to all of you from all over the world. It is evening here in Asia, daytime in the USA, afternoon in Europe, Africa, and down under in Australia, morning in Latin America, late afternoon in India, and evening in the Middle East. It is indeed with great pleasure for us to have 431 registrants in our webinar today from 54 countries. Imagine that, the reach of our MinOSH webinar. Top 5 coming from Indonesia, Philippines, USA, Uganda, and Zimbabwe. This is really amazing. Mining Occupational Safety and Health, or in short, MinOSH, is a scientific committee of the International Commission on Occupational Health. We are launching a series of webinars. Today, August 25, 2021, is our second webinar entitled Health and Safety in Small-Scale Gold Mining, Linking Data-Driven Research to Policy Directions in Preventing Mercury Poisoning. I am Jinky Leilani Lu, and I am glad to be your host today, and I am the Secretary of MinOSH. To start with, we have the welcome remarks by our chair, Dr. Eric Jors. Eric Jors is a medical doctor, Master of Occupation of International Health, and a PhD. He is a senior consultant at Odense University Hospital and associate professor at University of Southern Denmark. He is a specialist in occupational and environmental health. He is the founder and former president of the NGO Dialogos and founder of the International Committee of Public and Occupational Health within the Danish Society of Occupational Health. He has a working experience at grassroots level in Bolivia, Uganda, and Nepal since 1985. He is currently the chair of MinOSH since its start in 2015.
Thank you so much, Jinky, for this introduction, and a warm welcome to all of you from all over following us in this webinar on prevention of mercury poisonings from mining. We have an interesting program for you for these 2 hours. As said, MinOSH is a scientific committee within ICOH, the International Commission on Occupational Health. This commission hosts 37 scientific committees, of which MinOSH is one of them, and I think the youngest. ICOH is an organization for professionals in occupational health, and if you want to become a member of ICOH, that should be possible. You'll find instructions for that and more information on ICOH if you visit ICOH's homepage. Currently, there are 2,000 members in ICOH from 93 countries. Now, the aim of MinOSH is to disseminate and create knowledge on occupational health and safety in mining to prevent diseases and accidents in that sector, which is one of the most dangerous work sectors at a global level. Now, I'm the chair, and I'll serve as the chair for another half a year, and then our secretary, Jinky Lu, will take over. Jinky Leilani Lu is secretary of MinOSH since our last ICOH Congress in Ireland. She holds a Master of Occupational Health and a PhD specialized in gender health, technology, and health. She is a research professor at the National Institute of Health in the Philippine University in Manila. She has authored 2 books one on gender information, technology and health, and another one on the basis of occupational health and safety for practitioners and industry. And she has won several prizes for these books. She has also authored 60 peer-reviewed journal articles. And Jinky is a true advocate in promoting well-being for vulnerable groups like farmers, miners, and factory workers. So with these words, I welcome all of you and looking forward to hear the different contributions. Jinky, will you take over again, please?
Okay. Thank you, Dr. Eric Joyce. Our first speaker is from Indonesia. Mukhtaruddin Mansur is currently the chair of MinOSH Subcommittee on Conferences and Publication. He is the director of the Regional Center for Food and Nutrition of the Southeast Asian Ministry of Education, or SIMIO-REFCON. He is a professor at the Community Medicine Department of the Universitas Indonesia. He is a medical doctor, which he earned from the Universitas Indonesia Jakarta, and PhD in Health and Community Care from Leeds, United Kingdom. He is a former head of the Center for Hajj Health, Ministry of Health, Republic of Indonesia from 2016 to 2017. He was also the director of Occupational Health and Sports, Health Ministry of Health Republic of Indonesia from 2013 to 2016. He has several publications as well. To talk on heavy metal blood level among small-scale communities in pre-operational gold mining areas in Indonesia, please welcome Dr. Mansur.
Well, thank you very much, Jinky. Thank you very much, Eric. Very great day for all of you, the speaker, moderators, chairs, and also all of the audience, the participants. It is very pleasant that I can share one of our study about what Jinky mentioned. May I share the, heavy metal blood level and anemia status among small-scale communities in pre-operational gold mining area, Indonesia. Can you hear my voice clearly? Yeah, also for the screen, I think you can see the title of the presentation today, and I've outlined of introduction, methods, result, and summary. We know mining ores naturally consisted of multiple heavy metals. And large-scale gold mining areas often used to be traditional gold mining. In other side, anemia in children is prevalent in Indonesia. We know that heavy metals, especially lead, has main effect to the heme synthesis and causes anemia. The study was aimed at analyzing the heavy metal blood level and health status of villages residents in the pre-operational mining area. The study location is 3 villages in North Sumatra, including 202 pairs of household health or male adult and under 5 children 24 to 59 months old. They resided not in the traditional gold mining, and at least they have length of stay in the area more than 6 months. And we put the inclusion criteria as apparently healthy. Oh. Okay, well, we measure some health parameters. For mental health, we use the HL90 questionnaire. Physical health condition, including blood pressure, we use the physical examination measurement. Hemoglobin concentration, we use the methods of HemoQ. Capillary lead concentration, we use lead-Care2, and other heavy metal concentration, we use induced couple photometry, induced couple plasma mass spectrophotometry, I mean. The cutoffs of different health parameters, we use GNC7 for the blood pressure, hemoglobin concentration based on the cutoff point for anemia for adults, 13 gram per deciliters, and for under 5 children, we use the 11 gram per deciliter. The blood lead concentration, we use the WHO biological exposure index, 40 microgram per deciliters. We found that adult age mean is 35.4 years, and the children age mean was 3.2 years old, and male, the proportion of male is 52% compared to 48% for the female. The most proportion of educational level is senior high, more than 41%, and most of them as a farmer and field or technical work, followed by administrative and less than 0.2% unemployed. Mean of the length of stay more than 21 years, and the proportion is the most between more than 6 months to 10 years is around 34.4%. 66.5% of them is normal blood pressure, and hypertension is more than 10%. Based on the mental health, they perceive that around 3% of them have symptoms of mental health disorders, especially fatigue, followed by insomnia, abdominal pain, headache, and anxiety. The proportion of anemia among adults was 7.5%, but very high among the children. That was 27.2%. How about the bloodlet and other heavy metals concentration? The hemoglobin concentration among adults was 15.08 gram per deciliter, and children have hemoglobin concentration mean was 11.72%. For the bloodlet concentration, mean is 6.01 microgram per deciliter with the 95% confidence interval 5.78 to 6.25. And for the children, bloodlet concentration mean was 7.15 with 95% confidence interval 6.92 to 7.39. That was below the biological exposure index. Other heavy metal concentration was for cuprum, 844.14 microgram per liter. Zinc, 664.73, cadmium, 14.64 nanomole per liter, and mercury was 17.03 nanomole per liter. All of them are not exceed than the recommended safety level. In summary, there are some concerns on hypertension among adults and anemia among children. No concern on mental health, bloodlet concentration, and other heavy metals of adults and children were below biological exposure index based on WHO guideline. Well, that is for now. Jinky, thank you for attention for all of the participants. Return to you, Jinky. Thank you.
Thank you, Dr. Mukhtar, for that interesting talk. It is really important to document health and safety of community dwellers before mining operations so that the same health parameters can be measured when and during mining operations occur. Thank you so much. Our next speaker hails from Africa. Dr. Dingani Moyo is an occupational physician and lecturer at Midlands State University in Zimbabwe and at the University of Witwatersrand in South Africa. He has over 25 years of experience in the practice of occupational medicine in the Southern African Development Community. He has led occupational health projects dealing with miners and small-scale artisanal miners under the Global Fund and the United States Agency for International Development. He is a past board member of the International Commission on Occupational Health and ex-member of the South Africa Society of Occupational Medicine. Dr. Moyo is the chair of the ICOH Africa Education and Capacity Improvement Scientific Committee, as well as the co-chair of the ICOH-MinOSH Subcommittee on small-scale mining. Together with Dr. Stefan Bosé O'Reilly of the Institute and Clinic for Occupational, Social and Environmental Medicine at the University Hospital, Munich, Germany, they have worked on small-scale mining researches in Africa. It is with pleasure to have Dr. Dingani Moyo to talk on acute and chronic health effects from mercury exposure in small-scale gold mining.
Thank you very much. Please, can you share my slides? Thank you very much. Good morning, good afternoon, good evening to all participants, wherever you are. It is an absolute pleasure to run this presentation on the work that we've done in Zimbabwe amongst artisanal and small-scale miners, together with the Munich team led by Dr. Stefan O'Reilly. So today I'm going to be talking to you on acute and chronic effects from mercury exposure in small-scale gold mining. Next slide. So the outline of my presentation, next slide. The outline of my presentation, I'm going to speak specifically to the background of artisanal and small-scale gold mining, as well as focusing on the ASGM situation in Zimbabwe. Then eventually I will then talk about the health assessment study of artisanal and small-scale miners, which we did in 2019, together with the Munich team led by Dr. Stefan. Next slide. As we all know, generally, artisanal and small-scale gold mining occurs on a significant scale globally in more than 70 countries. And today, there are about 10 to 16 million artisanal gold miners scattered all over the globe. And there are over 50 to 100 million people who are dependent on artisanal gold mining. And the resultant takings from these issues leads to quite significant gold production to the artisanal and small-scale miners. But however, on the negative side as well is that there's significant release of mercury into the environment, leading to almost about 1,100 tons of mercury that is released per year. And obviously this has got quite significant negative health effects as well as environmental effects. Next slide. Coming specifically and focusing on Zimbabwe, Zimbabwe has got more than 500,000 artisanal and small-scale gold miners. Obviously, this is a gross underestimation of the magnitude of artisanal and small-scale mining in Zimbabwe. And we are aware that generally artisanal miners, they use archaic or rudimentary mining methods in order to extract the gold. And also artisanal and small-scale gold miners, they are characterized by a high mobility and operation in remote sites. And this trade in the Southern African space has been associated with a high burden of HIV/AIDS and TB, as well as silicosis, some of which is now referred as the triple epidemic in the Southern African space. Next slide. In Zimbabwe, it is a country that is endowed with significant mineral resources, and there is a specific belt across Zimbabwe that stretches from the northern part of the country to the southern part of the country called the Great Dyke, which is what is illustrated there in green. It is along this great belt of mineral resources of diverse forms, from your platinum, your gold, and all the other related minerals. And most of the huge mining corporates, they operate along the Great Dyke. And we also have got quite a significant population of artisanal and small-scale gold miners operating along the so-called Great Dyke in the Zimbabwean space. Next slide. Right, the diagram there, just click again, represents the process of extraction of gold, where it is crushed and then mixed with mercury, and then through the amalgamation process and the smelting process, the final gold product is realized. Click again, keep on clicking. This just depicts the artisanal and small-scale gold mining process to extract gold. And obviously, this is associated with a multiplicity of hazards, and more importantly, the next slide, more importantly, issues of occupational hazards such as noise and silica dust, as well as mercury exposure, are quite significant. Next slide. Let's move on to the next slide. Thank you. There's been quite a lot of studies that have been done in Zimbabwe in the past decade. The previous slide, please. In the past decades, where these have been done predominantly by our counterparts from Munich under Dr. Stefan. One of the initial studies was the Global Mercury Project in 2004, which was done in Zimbabwe, which showed the high mercury levels amongst artisanal miners. And another study in 2006 showed an increased burden of mercury in the breast milk or in breastfed infants from around mining sites in the Kadoma mining area. So this is quite a huge problem within the Zimbabwean space. Next slide. The other studies that have been done have also looked at the impacts of artisanal and small-scale gold mining in terms of their health, in terms of the needs that characterize this particular population. And some of the key issues that have been found from these studies is that education, knowledge, and awareness amongst these miners is a major requirement. And currently, even a recent study that is being conducted in Zimbabwe with one of our PhD students at Munich has showed on the preliminary results quite significant exposures to silica dust and noise, as well as chemical hazards amongst the artisanal miners. Next slide. All right, then zeroing on our study that we conducted in 2019, which was a cross-sectional study on 207 artisanal and small-scale gold miners in the areas of Kadoma and Shurugu in Zimbabwe. We measured the occupational exposures using urine and blood, where we found quite significant elevated levels of mercury. We also evaluated or analyzed the correlation between the exposure risk factors and the mercury levels, as well as carrying out medical assessments of mercury-related symptoms. And fourthly, we looked at the health-related quality of life of these 207 artisanal and small-scale gold miners. Next slide. And in terms of the results, what came out from these results is quite interesting. More than 52% of the artisanal miners had elevated mercury levels, exceeding the human biomonitoring levels 1 and level 2. And out of these, 92, which was 33% of the population, had mercury levels above the threshold limits, and 9 of them had chronic mercury intoxication. And we also found a positive correlation between the exposure risk factors with the mercury levels, and also the duration of exposure, the use of retorts, and also the use the storage of mercury within the homes of these artisanal miners. They correlated very well with elevated mercury levels. And on the health-related quality of life, quite interestingly, about 58% of the artisanal and small-scale gold miners reported being unwell in different ways. And the conclusion that we made was that chronic mercury intoxication influences the quality of life amongst the artisanal and small-scale gold miners within these areas in Zimbabwe. So as you can see, it's quite elevated levels. There is an increased burden of mercury amongst this population. And it's quite unfortunate because we all know that mercury tends to target the cerebellum, where it can cause even permanent and irreversible damages amongst the population. So at the current moment, with the levels and the numbers of exposed artisanal and small-scale gold miners, and what we have seen is of much of a great worry or of a great concern within the population of Zimbabwe. Next slide. It is also quite important to look at this burden of mercury amongst the artisanal and small-scale gold miners in Zimbabwe, in the context of these effects, we all know that organic mercury causes acute effects such as your cough, your breathlessness. It can cause chest tightness and pneumonitis, as well as gastrointestinal complaints. But however, I think next slide. The major issues also now relate to the chronic effects of mercury poisoning, and typically where mercury will cause you tremor, ataxia, and even coordination problems. And next slide. Let's move on. Yeah, these are just examples of chronic exposure to mercury. And here I'm trying to highlight these in the context of the burden, where you've got more than 52% of the mining population are being at a very dangerous level in terms of exposure. And you can look towards the next coming generations in terms of these chronic manifestations, which is a worrisome concern. Next slide. Right, this concludes my presentation, but more importantly, would like to thank and acknowledge the funders of this research, the German Federal Ministry, as well as the Munich team led by Dr. Stefan in Germany. Thank you very much.
Thank you very much, Dr. Dingani Moyo. It is really unfortunate that although small-scale mining and artisanal mining brings income to the households, but they suffer from both psychological and physical health effects. Dr. Dingani showed us the relationship or the correlation between exposure to mining chemicals and the actual mercury levels among the mining population, and affecting as well the quality of life of the population. So it's very important that we uphold and promote occupational safety and health in mining communities, particularly in small-scale and artisanal mining. For over 30 years, Dr. Paul Weihe has led the Department of Occupational Medicine and Public Health in the Faroe Islands, and for part of this period as medical director of the Faroese hospital system. He is also an adjunct professor at the University of the Faroe Islands, a visiting scientist at the Harvard H.T. Chan School of Public Health, and a visiting scientist at the Institute of Public Health at the University of Southern Denmark. Between 2005 and 2016, Dr. Weihe served as chair of the Faroes Board of Public Health. Dr. Weihe is deeply committed to serving his community through the provision of medical care and devotion to his work on minimizing community exposures to marine contaminants. Specifically, he has overseen the examinations of over 3,000 Faroe Islanders of 5 prospective studies of birth cohorts exposed to marine contaminants associated with neurotoxicity, growth and development, immunotoxicity, and endocrine disruption. He is also involved in other research areas, such as reproductive toxicological studies of time to pregnancy and semen quality, as well as age-related functional deficits and degenerative diseases. Weihe has published more than 150 scientific papers in peer-reviewed scientific journals and books, and has been invited to more than 120 conferences and lectures. An impressive biography and body of works. A great pleasure indeed to have Dr. Paul Weihe to talk on global pollution with mercury and health effects in children and the fetus.
Here we are. Thank you for introducing me. Hello, everybody. I'm gonna talk to you today about a part of my research in the Faroes. We have done so for more than 30 years. but the heading is Global Pollution with Mercury and Health Effects in Children and the Fetus. Next, this slide. Yeah. Releases of heavy metal to the environment as a consequence of human activity began millennia ago with the inception of mining and smelting, but have accelerated greatly in recent centuries, most especially in the last 100 years. Mercury is a metal pollutant of, at least in the oceans, of great concern to human health. Over the past 5 centuries, human activities have increased total environmental mercury loading by more than 4 times above natural background. About 70% of the mercury circulating in the environment today consists of mercury emitted from human sources in the past. The presence of large quantities of legacy mercury in the global environment and the potential for climate change to remobilize the mercury complicate projection of future exposure and health impacts. When I say remobilize, that can be, for example, from the Arctic tundra and the ice cap. Yeah. About 30% of mercury emitted annually to the atmosphere is a result of current human activity. Combustion of coal and artisanal small-scale gold mining are the 2 principal sources. Coal combustions releases mercury because coal contains mercury, and when coal is burned, mercury is vaporized and discharged into the atmosphere, where it can travel for long distances until ultimately it precipitates into rivers and lakes and the oceans. And the artisanal small-scale gold mining, mercury is used to form an amalgam to separate gold from the surrounding rock or sediment, as we have been told. Next slide, please. Mercury emission from coal combustion and artisanal small-scale gold mining and other sources is released to the atmosphere almost entirely in an inorganic form, and it is still in an inorganic form when it deposits sites on land or water. Mercury released directly to water is also entirely inorganic. Once in the marine environment, inorganic mercury is transformed by microorganisms into an organic form of mercury, metal mercury. Metal mercury is far more toxic than the inorganic mercury. Analysis of museum samples reflects the increase in mercury emissions and releases since the mid-19th century associated with anthropogenic activities, as you can see on that graph. Sorry. No, you're back. Sorry. In general, we can say that toxic effects are determined by toxicant properties. The dose and the timing in regard to windows of vulnerability. Metal mercury has shown to be particularly toxic to the brain before birth. The developing human brain is the organ most vulnerable to metal mercury, and this vulnerability is greatest during the 9 months of pregnancy, when the human brain is growing and developing most rapidly. Therefore, considerable effort has been used to document the effects of prenatal effects in child cohorts. Next slide. Several epidemiological studies have been conducted to estimate the health effects of metal mercury at different life stages. The toxic effects have been documented at progressively lower level of exposure, as increasingly sensitive and sophisticated diagnostic instruments have been applied over the past 40 years. And here you can see a a picture of my first research team when we started out in the mid-80s. Next. Prospective cohort epidemiological studies undertaking in the Faroes have demonstrated that children exposed to metal mercury in utero exhibit decreased motor function, shortened attention span, reduced verbal ability, diminished memory, and reduction in other mental functions. Follow-up of these children at the age of 22 indicate that these deficits persist and appear to be permanent. Next slide. In the Faroes birth cohort studies, there was a significant difference in reaction time. I'll give you some. Can you have the former slide, please? Take the other one. Can you go back? Yes, that one. In the Faroes birth cohort studies, there was a significant difference between reaction time at age 7 years. The highest exposed had longer reaction time, as you can see on this figure, than the less exposed. The high exposure is 50 microgram per liter, and the low exposed are under 15 microgram per liter. And you can see that the difference in reaction time in milliseconds is clearly. Next slide. In the same study, prenatal mercury exposure was associated with the development of delay. For each doubling, for example, of exposure, we found a delay in verbal memory about 2 months. As you can see here, and in motor, it's around 1.9 months, and attention is 1.3 months, but for every doubling of exposure. Next slide. When measuring electrical signals, evoked potentials, we found prolonged 3-5 intervals on brainstem auditory evoked potentials associated to hear mercury in children at age 7 and 40 years of age. This indicates that mercury is inhibiting the electrical signals in the brain. Next slide. After 3 decades of research, this child cohort, the conclusion on developmental neurotoxicity relates to mercury are that neurobehavioral effects, not clearly on attention, memory, and language, but also visuospatial and motor function, that we have parallel neurophysiological findings, and prenatal exposure was generally more toxic than early postnatal exposure. And the results from age 14 and 22 suggest that the effects are permanent. Next slide, please. An expert panel convened by the US Environmental Protection Agency in 2011 concluded that metal mercury is directly linked to acute myocardial infarction and to increases in cardiovascular risk factors such as oxidative stress, atherosclerosis, decreased heart rate variability, and to a certain degree, hypertension. As you see on this is from our first birth cohort, the blood pressure at 7 years. You can see there is an association between cord blood mercury and both diastolic and systolic blood pressure in the low exposure area. Next slide, please. The beneficial effects of seafood nutrients such as omega-3 fatty acids, including DHA, may mask some of the adverse effects of metal mercury. So compensating, so fish intake low in mercury seems to be to some degree compensating. Next slide. The toxic effects have been documented at progressively lower levels of exposure for the last 4 or 5 decades. The safe threshold has declined. The current reference dose used by US EPA is based on effect data from our studies in '97. However, recent findings indicate that even lower effects with neurophysiological methods and in groups with genetic predisposition. Next slide. There has been estimated that between 300 and 600,000 babies are born in the United States every year with losses of cognitive function that are the consequence of prenatal exposure to metal mercury from contaminated fish consumed by their mothers during pregnancy. These losses ranges in magnitude from 0.2 to 5 IQ points, depending on the severity of exposure. In EU countries, 1.8 million babies are born every year with elevated metal mercury exposure that are causing an estimate of loss of IQ points of 600,000 annually. So this is quite a big impact. Next slide. Two actions will be critical for preventing the that additional mercury ends up in the environment and in the oceans. These are the cessation of coal combustion and control of mercury use in artisanal and small-scale mining. Cessation of coal combustion will not only slow the pace of climate change and reduce particulate air pollution, it will also greatly reduce atmospheric emission of mercury and thus reducing additional deposition of mercury pollution in the oceans. Artisanal small-scale gold mining is a major source, and as mentioned before, action underway under the aegis of Minamata Convention on Mercury are seeking to identify and control major sources of mercury pollution from ASGM. So the future is quite dependent on this. This action will be successful. Thank you.
Thank you very much, Dr. Paul Vaihe, for that very informative talk on the adverse effect of mercury among children and the adult. So far, we have learned the adverse effects of mercury to the mining population and to the people as a whole. So it is very important and vital that we find strategies to reduce mercury levels in our human activities, including mining activities. And so that is the topic of our next speakers. It is indeed unique, but very interesting to have two speakers for the next topic. This definitely brings a more interdisciplinary perspective of the subject matter. First, Dr. Marieke Kroll, PhD, is the Director of Health and Research of the Artisanal Gold Council, or AGC. Marieke is responsible for overseeing and taking care of the success of a variety of health-related activities across the AGC's programs. In particular, she is responsible for supporting countries in developing national public health strategies, for developing health curricula for healthcare professionals, for designing health data collection tools, and for producing health reports. Marieke brings over a decade of work experience in public health and sustainability research in South and Southeast Asia, as well as in policy advice. Next is Douglas Cow, the mineral processing engineer of AGC. Douglas Cow holds a mining engineering degree from the University of British Columbia and has been engaged in the world of ASGM since 2019. He brings about a practical approach to problem solving by drawing his experiences in industry for nonprofit sector. A zealot of field work and sustainable development, his primary role at the AGC involves the technical design, coordination, and management of establishing responsible gold extraction systems within ASGM communities. This has brought him internationally to project sites such as Indonesia, Mongolia, and the Philippines to talk on AGC's different activities to reduce mercury use and exposure in the sector with a focus on mercury-free processing systems. Please welcome Marijke Korrel and Douglas Cow.
Thank you very much. Thank you for the introduction and also for the opportunity to present our work today. Could you please start the presentation?
Do you want me to share your presentation, Marijke?
Yes, that would be great. Otherwise, I can probably also share it quickly.
Yeah, I'm sorry, because I don't have your PowerPoint actually.
Okay. Can you see my screen now?
Yes.
Okay, perfect. So I will start briefly providing an overview about AGC's integrated approach towards mercury reduction today, and then talk about our health-related activities. And after that, Douglas Cow will talk about technical solutions for mercury-free processing. The Artisanal Gold Council has over 15 years of field experience in improving the sector in over 20 low and middle income countries. Our headquarters is based in Canada, and we're indeed a very interdisciplinary team of about 20 experts, and we have national offices currently major in our larger projects. That's Burkina Faso, Indonesia, Mongolia, the Philippines, and Peru. And our mission is to improve the livelihoods of artisanal miners through an integrated and multi-stakeholder approach along the supply chain, which reaches from miners and national stakeholders to refiners and linking those to markets. So the AGC is a very field work-based organization, which is obviously bringing some challenges in terms of the current pandemic, but we really work with communities and also local and national experts to develop solutions which are not only very practical, but also context specific, taking into account the different social, economic, geological, legal frameworks ASM communities are embedded in. And our overall goal is to build an environmentally sound, socially responsible, formalized ASGM sector, which can effectively transfer wealth from rich to the poor. Below here, you see our seven major core topics. Health is one of those, which is a cross-cutting issues among all our activities, as is, for example, also gender. Most of our projects address several of these four components as they are outlined here, as it is very challenging in the ASM sector to reach progress with isolated actions. That makes our work very interesting and very challenging at the same time. On this slide here, I just want to provide a few examples from more recent activities. For example, when we look at the policy and formalization component, the AGC has been supporting governments in 10 countries to develop national action plans. In Mongolia, our project team is part of the National ASM Task Force, which is currently working on a revision of ASM legal frameworks. And in Peru, our team has been working with the government to control mercury trade, but also to work on guidelines of interim storage of mercury. In terms of capacity building, all those pillars are obviously very closely interlinked. We are working with the government in Papua New Guinea to train government officials in developing a mercury inventory, which is one of the preparatory steps for Papua New Guinea to become a party of the Minamata Convention. And we also offer training activities in various aspects related to mercury. The component of mercury-free technology is a very important pillar of our work, and Douglas will talk more about that. Solutions range from more centralized plants in Indonesia to more mobile solutions in Suriname. However, Access to technology is also linked to access to finance and access to fair markets. So this is another pillar where in Burkina Faso, for example, we have a project focusing more on gold trade, but also progressive due diligence lab, which is trying to link miners to responsible markets, or Mongolia and Philippines, we're more working on social enterprise models. All these activities have health as one cross-cutting activity, and linking our activities to the topic of the webinar today, would also like to highlight our research and development component, which is usually built in to those various activities. Just to give you an example, in Peru, one of our team members currently going around with Jerome to measure mercury vapors in different interim mercury storage settings. Or in terms of technology, we also constantly work on different solutions for different types of ores and deposits. However, as I said, our goal is actually mercury-free recovery methods, which require a lot of capital in terms of finance, technology, and knowledge. So our general approach is to engage to improve, which means if eliminating is not possible, we start at least with preventing the worst practices as identified in the Minamata Convention. This obviously is linked to health knowledge of miners and mining communities. So our health program has mainly 3 target groups, starting with miners and their communities, the healthcare community, but also public health agencies on a more policy level. The activity that are linked to these major stakeholder groups can be broadly categorized or grouped into 3 themes. One is research and monitoring. Most of our studies, before we engage with communities, assess the existing sector in its various subjects, including also occupational health and safety, to identify the most pressing issues and to think about solutions. We've also done institutional capacity assessments of the healthcare sector to identify existing gaps in access to healthcare, but also quality of care, or also to think about how health programs for HGM communities can be implemented. Capacity development initiatives have been developed for miners, health workers, but also government officials. And on a public health policy level, we have mainly provided advice for governments to how to develop public health strategies for the HGM sector. This is leading to 2 examples of current health activities. One is in Papua New Guinea, where we have a project funded by USDOS. One of 4 pillars is the training of health workers to conduct community awareness programs. In 2020, I conducted a knowledge attitude practice survey among a small group of clinics and hospitals in ASM and mercury hotspots. The CAP study revealed that knowledge on mercury intoxication was almost non-existent. So I started with 3 small trainings. However, at the moment, we're planning a more complex training program, which will be carried out once COVID travel restrictions allow. And this training will also include a handbook for health workers for self-study, as well as materials for communities, because the idea is really to develop materials for different stakeholder groups, which are adequate. You can see on the right side 2 examples of 2 graphs. And for us, it is really important to encounter existing misconceptions among miners, how mercury can impact health, to really increase awareness and to encourage miners to change their behavior and to protect themselves. For this purpose, we obviously also rely on findings from the scientific community. So my thanks at this stage to all the different presenters, but especially also to Dr. Dingani and to Stephen Bowser-Riley, whose work has been really helpful to look specifically into the health effects of mercury intoxication and to produce different materials. Another example is from Mongolia. And since I just realized that there are so many participants from the Philippines here today, some of these activities will also be carried out in the Philippines in our Planet Gold project. In terms of capacity building, we will do a training of certified OHS trainers, which are a member of the ASM National Federation in Mongolia. This will happen next month online. And then with these trained OHS trainers, we will conduct training of miners in 3 provinces. And next year, we will also start with capacity building activities for government officials. Another activity I would just briefly like to outline here is access to healthcare. So the Mongolian government in its national action plan has set the goal that they want to increase access to healthcare for artisanal miners to about 80%. However, at the moment, it is not really clear how this access to healthcare could be implemented. So one of our goals is to do a feasibility study, which looks into access to social services, including healthcare for miners. And Mongolia is a very interesting example because there have been several studies looking into mobile healthcare provision for mobile communities, such as, for example, herders. So there are certainly a lot of interesting lessons learned. And to link that again to the topic of the webinar today, evidence-based decision-making, or how linking data to policy, another example or another strategy of the National Action Plan in Mongolia is also actually to establish a public health surveillance systems for miners where, for example, through different screening measures, data can be collected on a continuous basis to monitor the situation. So this is certainly something where more research, more guidelines are required, and where we are also currently actively looking for opportunities to work on these measures. And with that, I would like to hand over to Douglas for the technical part of the presentation. And Douglas, I assume you will have to tell me when to go to the next slide.
Sure. Good morning, everyone. Can everyone hear me?
Yes.
Hi, hello and good morning from Victoria, British Columbia, here in Canada. It's currently 6 a.m. here, so I hope wherever you are, you're a little bit more awake than I am. I'll jump right into it. My name is Douglas Cow. Today, I'm representing AGC, technical department. There's about 10 of us scattered throughout our country projects. So this is just an acknowledgement for their contributions overseas for the overall mission of my organization. Next slide, please. So to begin, I'd like to just touch on AGC's technical design philosophy. First and foremost, a mercury-free system is not just about the equipment. It's really a comprehensive system with a large component focused on capacity building. And a lot of the times it's to explain what I call is the mineral processing 101. So it's the training of topics such as particle size liberation, brand size control, assaying, mass balancing, recovery calculations. And this all goes hand in hand with the new and improved equipment that is oftentimes implemented. So to begin, we try to gather a firm understanding of the existing ASGM ecosystem. This is to decipher the nuances of ASGM operations and to begin building a relationship with the miners so that ultimately trust can be developed. This also serves as a cross-validation of data, of important data that the miners report to us, as oftentimes there are low levels of record keeping. And so we do this using a number of ways. Initially, there will be a site assessment that's carried out in order for us to identify a project site, followed up by field visits. So after all this data has been collected, the next thing we try to think about is technology appropriateness. So what does this mean? So what it means is not only is the technology technically more advanced, but we have to ask ourselves, is it socially acceptable? Will it be accepted by the mining community? Will ownership be developed? And will the miners ultimately continue using these equipments and technologies after the project implementer is gone? The second question is it politically acceptable? So will it garner the support of the local government? which ultimately dictates whether certain operating permits are attainable during a project's life. And of course, is it economically feasible? So will the miners be increasing their bottom line using our technology, or will they just revert back to the methods that they used prior? Is it environmentally sound? And another question we have to ask is, what are the potential unintended consequences? So one example I want to highlight right now, so there are oftentimes low-level labor roles in ASGM. So one role includes rock breakers. So these are miners that use hammers to crush ore. And all of a sudden, they may suddenly be displaced by something like a jaw crusher. So it's planning ahead and making sure that the miners have a continued role with this new system so that all of a sudden they're not jobless. And if there's one message that I hope you all take away from my presentation, it's that there really is no one-size-fits-all solution. I believe it's a mutual two-way dialogue with the miners in order to come up with a solution that fits for everyone. Next slide, please. So in this slide, I hope to address the importance of understanding why miners continue to use mercury, despite most of them really knowing of the having some degree of understanding of the harmful effects of mercury. So there are barriers to change that I like to discuss. Mercury is oftentimes seen as a convenient, cheap, and relatively efficient method of gold extraction. It can be easily stored, it can be easily concealed, and generally it's available to be sourced. The adverse long-term effects are difficult to grasp by the miners, especially for truly sustenance miners who may not have the capacity to plan weeks, months, much less years ahead. And even if the first two barriers weren't an issue, there are external factors that prevent miners from adopting these technologies. So in Mongolia, one example, it's chemical usage is highly restrictive. So the miners really have no other choice. And the technologies are oftentimes too capital intensive. So these high entry barriers also prevent miners from adopting new technologies. Next slide, please. So here I've just presented a basic gravimetric mercury-free circuit. It's important to revisit the idea that there's no one-size-fits-all solution, but this does oftentimes serve as the basic skeleton of which we build modifications on. This particular plant has been designed for one of our Mongolian facilities. It's rated at 5 tons per day with an expected recovery of 60 to 70%. So this may seem low, but again, this is purely a gravimetric circuit. So to run through it quickly, gold enters from the front end through our primary crushing, that's shown by a jaw crusher. It moves on to a classification vibrating screen where the oversize is recrushed and the undersize advances onto the grinding stage. We have a parallel grinding circuit, one with higher tonnage and the rod mill producing a lower tonnage. We believe it's important to make sure that both options are available in order to service as many miners as possible, as not all miners produce the same amount, and oftentimes, usually, miners don't wish to mix their ores with other miners for fear of gold entering someone else's pocket instead of vice versa. Once the desired particle size is achieved, the slurry is homogenized in a mixing tank. And in this particular circuit, it enters a two-stage shaking table process where the shaking table concentrates are further upgraded through smelting, and the tailings, which really aren't true tailings as they may contain upwards of 30 to 40% gold, moves on to secondary processing. Secondary processing includes other technologies such as leaching, or if the mineralogy allows it, flotation, or if chemicals are highly restrictive, then we may install a centrifuge. But again, this is a very sensitive piece of equipment, as with others. So a very high level of mineral processing knowledge is needed. And in the particular case of centrifuges, a very high water quality. Next slide, please. And Mariki, if there's a play button. Perfect. So this is another facility of the AGC. This one in particular was built in North Sulawesi, Indonesia. So you can see here, it's a very nicely laid out circuit. The video is a bit laggy, but you can see that there's a primary and secondary crushing circuit on the right, followed by water tanks, a standard ball mill for grinding. Here we're showing the settling tanks that allows for water recycling. And in the back, the four box-like equipment, those are flotation tanks and a shaking table. So this facility allows for 3 types of technologies to be tested. So flotation, gravimetric separation, and leaching. Next slide, please. So here, I'd just like to highlight one particular unit process. This is the smelting process that refines gold concentrate into a sellable product. So what happens, you have the gold ore that's been slightly concentrated, or that has been concentrated. And what happens is that you heat this at very high temperatures, over 1,000 degrees Celsius, and you add a flux agent. So that's something like silica, borax, sodium carbonate, or litharge, which is a lead monoxide. And the flux agent does a few different things. One, it lowers the melting point of metals so that less energy is required in the process. And a second outcome of the fluxing agent is to increase the viscosity. And what this does is promote the separation of the precious metals and the impurities, which is known as slag. So this is lighter material that flows to the top, and the gold and other precious metals like silver sinks to the bottom due to the density differences. These photos show one of our engineers that's about to pour the molten mixture into molds, whereby then a gold button is produced. So next slide, please. If all goes well, you produce some mercury-free gold. So this particular piece is worth about $400 to $500 USD, assuming a purity of 60 to 70%. So you can see that it's not totally gold. There's a bit of a silvery luster to it, and that's because there is some silver in that button. Next slide, please. So in my last slide, I just want to focus on the importance of planning for a project's legacy at the beginning as opposed to the end. And this contributes to the long-term sustainability of a successful project. We want to make sure that there is a lasting impact for any mercury-free technical installations. And one good way of measuring this is gauging how well the equipment has been adopted. And not only that, but how far it's been disseminated in the community. And a good way to measure this is to see if any miners, even outside the scope of a project, is now utilizing the technology. And again, a mercury-free system is not just about the equipment, it's the whole suite of mineral processing knowledge that follows along with it. So process control is very important. And what this does is allow the miners to gain a fundamental understanding of how their gold is being produced so that they have the capacity to continue optimizing their processes long after the project implementer is gone. In contributing to a sustainable business model, it's important to determine in the beginning whether a community requires ongoing support or if it's simply just seed funding to kickstart the miners. And as my last point, I'd just like to point out that technical solutions always contain a socio-economic component. So it's very, very vital to develop trust with miners in order to collaboratively come up with a solution where they are part of it and ownership is developed. And thank you for your attention, everyone.
Wow, gold can be humanity's best friend. Thank you so much, Maraike and Douglas, for that very informative lecture. A very good takeaway from Maraike's lecture is that what is research without advocacy and capacity building? And what is capacity building and advocacy without research that is based on data-driven information? And that is why researches should be the basis of policies and programs of governments, both local and national, and even international organizations. And as Douglas said, technology is not merely a hardware or a software, but indeed a political and a socio-economic commodity. Okay, and now to proceed, we have another power duo, a medical doctor and a geologist. Rasmus Koster Rasmussen is a senior project leader in Dialogos gold projects. Rasmus has been working with mercury pollution from artisanal and small-scale gold mining since 2007 and started Dialogos ASGM group with Peter Appel in 2010. He has a postdoctoral degree from the University of Copenhagen Institute of Public Health. He is specializing in family medicine, part-time research, and part-time clinical work. His main research areas are weight changes, diabetes, and public health. Next is Peter Appel. He is Dialogos senior geologist in gold projects. Peter has been working with mercury pollution from ASGM since 2005 and started Dialogos ASGM group in 2010. He earned his economic geology degree from the University of Copenhagen. Peter has been working to reduce the use of mercury in small-scale gold mining process around the world for 20 long years. His company, Appel Global, focuses on reducing global mercury pollution.
Hi, and welcome to this talk with Peter and I. I will just share my slides so you can see. Hang on, this one. We are in Copenhagen, in Denmark. Sorry. And we are sitting right here in my clinic in Copenhagen. And I think you have the presentation here, and I have got it on full screen now. Here we go. Thank you for the presentation. I will go on and introduce us a little bit more later here. Peter and I are in the NGO that is Dialogos. This is not our full-time job because I'm a medical doctor as a full-time job, and we sit here in my clinic in Copenhagen. But we have been working in making projects with Dialogos, introducing a mercury-free method and implementing it in several mining communities. And the talk today is kind of a view back on the projects that we have conducted over the years. During the last 15 years, we have had at least 8 or 10 Dialogos projects, and we will look back at them and see if we can make a conclusion about what factors were predicting that a change to mercury-free mining communities. We have had the basic idea of the Dialogos projects are basically that we in 2007, Peter and I went to Indonesia to study the mercury pollution from small-scale gold mining. Sorry, Philippines, yeah. And in the Philippines, we found this area, Benguet, that is a mining community where they don't use mercury. So they use mercury-free technology already and have used it for many years, for generations in the Benguet area. And at the same time, we saw this big, very heavy pollution from other mining communities, and we concluded that we must get the miners from Benguet to teach the rest of the miners in the Philippines how to use mercury-free technology for small-scale gold mining. This picture is not from Benguet, it's from Kalinga, a neighboring mining communities that was in one of our project areas that is now completely mercury free after our project there. We also have projects in Africa and in Bolivia and in other countries. And since many of the members in Dialogos are researchers and have experience with writing scientific papers, we have over the years made a lot of scientific articles here, some of them from peer-reviewed papers about introduction of the mercury-free method in different settings. And one of them is this publication that is a 2-year follow-up study with a baseline and follow-up measurements of mercury use. So what we're going to talk about today is a data-driven, data-based experiences that we will share with you about the Dialogos projects. And we will look at those project sites where we succeeded in stopping the mercury use, and those mining communities where we did not succeed in stopping the use of mercury, and try to draw some conclusions on that. What you see here is a gold that is produced without mercury in one of the mining communities, and the method that the Benguet method, or the method that the miners from Benguet use, and the method that we implement in our projects we will tell you a little bit about it here, because we have experienced that many sometimes been met with skepticism that it doesn't work, but we know that it does. We have documented this in many papers, and Peter will just give you a short introduction to how this method works, so you have an idea. Peter, you can just start talking.
Yeah, I have worked together with a small group of small-scale gold miners in the Benguet area of northern Philippines. Here you see a small mining site, and this is one of the tunnels where they mine the ore. And the small wagons, they are bring the ore down. Here you can see the milling process, and the milled material is then brought down over these chutes, where they have a piece of cloth, a piece of felt, and the felt there is in the bottom, and all the heavy minerals, gold and other heavy minerals, are captured by the felt. And then the miners, you could see this is the felt, and then the miners take all the felt up, and here you can see they collect it, and then they wash the felt. So all the small scale, the heavy minerals get out. And here my partner in the Philippines, Leon Chunaoy, is making a gold concentrate. And this is the final result. You can see a nice little gold concentrate, but also some other minerals. And this is the next problem, to get rid of the other minerals. And here you can see this put in a piece of plastic, and now it's ready. Then they put it in a clay bowl, and add some borax, and here it is prepared for the milling, and here the gold concentrate is put down. And what happens here is that the borax, which is very small quantities, the borax make all the minerals melt, and all the elements go into borax glass. But gold, the metal gold, cannot be accommodated in the glass, so it sinks to the bottom, and then there's a glass disc, and below that there's a gold pearl. And here you see the final result.
And as you see, this method does not require a lot of equipment. This is equipment that most miners can afford. They basically need a blower so they can make the little bit higher temperature than they are needed for amalgamation. So we go back to this one here.
Så skal jeg sige noget om introducerende.
Yeah.
Yeah, so this is the method, but then we come to a small-scale mining community in country X, and I stand up with my team of Filipino small-scale gold miners and tell them that we can teach them to get more gold out of their ore, and they look at me as I look at my politicians, that's promising, 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 and never fulfilled. So I say to them, well, we will make an experiment. So we mill, say, 2 tons of gold ore, and then we have this pile of milled material. We split it in 2, and then one load goes to the local miners who use mercury to extract gold, and we take the other one and do it mercury-free. I count the time, how long it takes. In general, our method takes about 10–20% more. And then I weigh the gold coming out, and we always, when it goes to between 20 and 50% more gold than the traditional method.
And we can add on that the list of publications you saw just before, many, I think 4 or 5 of them are actually reports from this testing the amalgamation method against the mercury-free method, and it's a consistent finding that there's a higher gold yield in the mercury-free method.
And also noted that people don't need to buy mercury, and mercury is terribly expensive because it's illegal. So they save money not buying mercury and get more gold. So it's a win-win situation.
So a little bit about Dialogos projects, or Dialogos in itself. It's a tiny NGO, 250 members of these 30 active members with different projects. Some of them are gold projects. The focus is health and environment. It's a non-profit volunteer organization. So the work we do in Denmark is volunteer, and when we go abroad, sometimes we get some compensation for our salary loss. But in general, it's not the Dialogos that do the work. It's our local partners around in the world, in Uganda and in Philippines and Mozambique. And I know that some of them are listening in today. I know that Dr. Sikimbi from UNACO is listening in today. As you can see here in this sign, I actually think this is a good example, because we see here Dialogos is along with like the municipality of Tivoli. We often work with the local authorities and also with the health authorities, and then in this case a local partner that was banned toxics in the Philippines, a local or a Philippine environment organization. And Dialogos is funded mainly by the Ministry of Foreign Affairs of Denmark. And what we do is civil society interventions. That means that we work on many levels to implement this change in the mining community. There are miner-to-miner trainings. There are organization of the miners and the mining community, including umbrella organizations for the miners and the miner associations. Also, I think regular actually labor unions for miners, but also women's organizations and youth organizations and local mercury phase-out committees with the local authorities, local government units. And then together with our local partner, we make courses for healthcare staff, we make courses for school teachers, and we do a lot of political advocacy, both locally on a national level often we work together with the national environment agencies also. If we take our projects at a glance, then I have listed them up here in order, and we see up here there's the 5 first projects are finished and are over now, and if we and 4 more projects here in Uganda and 2 in Bolivia that are still ongoing, and what we see is that that in some areas we have had success. For instance, in Kalinga in Luzon, it is completely mercury-free still and has been mercury-free now for ages. We have had a project area in Camarines Norte that we worked in for 6 years and put a lot of effort into, and nothing happened. We changed nothing. They used exactly the same amount of mercury when we left as when we started. Another example is here in Tipuli in Mindanao, also in the Philippines, where we managed to get the miners to stop using whole ore amalgamation. So there was a considerable reduction in mercury emission from this area, but they did not stop completely using mercury for many reasons. In Mozambique, in our Mozambique project, there was 2 project areas, Nanlia and Wakwaya, and one went back to using mercury straight after the project ended, and the other one is still mercury-free in Nanlia. With the other projects in Uganda and Bolivia, we must see what the time will show. Also, we conduct these projects together in Dialogos, but Peter also conducted projects on his own with his own company, Apple Gold, and maybe you can tell a little bit about these projects, Peter.
Yeah, there's one project in Mauritania, which is funded by the German government. And there's another one in Sudan, which is funded by local sources, and another project in Nicaragua, where we have tested how to extract mercury and gold out of tailings from small-scale gold miners. And the most recent one, which is the biggest one, is in Honduras, where we will test whether we can clean rivers from mercury, and we will teach the small-scale gold miners to go mercury-free, and we will find ways to reduce pollution of one of the bays in Honduras, where they grow big tonnages of shrimps and clams, which unfortunately right now are full of mercury.
So if we should make some conclusions of our 10 or even 15 years of projects with implementing this mercury-free method, then I think we can tell that it's a mixed experience. Implementation of mercury-free small-scale gold mining is possible, but it requires long-term intervention and strong local partners. We have experienced that a collective decision to go mercury-free that is anchored in a local organization or by local authorities is much more sustainable than decisions by individual miners that have a tendency of, even when they use even if they use the mercury-free method for some time, they tend to go back if they get, if they have a bad experience or whatever. They maybe they get some poor ore or something, and they think it's the new method that explains this. So certainly a collective decision is far more sustainable than decisions by individual miners. And to do this, it's our experience that strong miner organizations is an important factor for the change. And it's also our experience that collaboration with authorities is a very important factor for the change. Working to formalize the sector, that is, I think, ultimately the way we have to go in order to stop not only mercury pollution from these small-scale gold mining communities, but also like Dr. Moyo was telling about that there are many other health hazards than mercury. There's also very poor working conditions and dust, infectious diseases and other child labor and so on. So in order to improve the working and living conditions, the way must go through a legalization and a formalization of the small-scale gold mining sector. And we have had a success with this actually in one of our projects areas in Uganda, in Buveju, that last year was given an area of 35 square kilometers to mine for the small-scale gold miners in the community. And this was a decision made by the parliament. So this is very interesting. This is the work that is ongoing now, and it seems like that we can get influence on how this is going to be organized, and obviously it's going to be a requirement that the operations have to be mercury free in this new area. So very interesting, I think, and it also shows that it is possible to actually get it legalized and formalized. So I think we can conclude that the mercury-free method that we learned from the Benguet miners in the Philippines, it is a doable method, and it's certainly a doable alternative to some of the retort projects that often are difficult to obtain, like a sustainable change among the miners. And it also had the advantage that you don't need a heavy machinery like other mercury-free alternatives require. So in conclusion, I think it's a time for action, and large-scale projects are needed for this, but obviously Dialogos is not an organization that can lift this. We are a tiny organization that can bring up ideas, but I hope that many of you out there that listen in will take some, will copy our concept and use this method to implement the mercury-free gold mining communities around the world. Thank you.
Thank you very much, Peter and Rasmus, for your advocacy. And our speakers have shown that it is possible to do mining without the use of mercury. And we really have to advocate for a toxic-free world, and one of which is promoting mercury-free gold mining. And we had a wonderful variety of topics today, and it seems that we have vicariously traveled around the world: Africa, Indonesia, Philippines, the Faroe Islands, relating to mining communities and the mining populations, and how mining is carried out, and how to prevent the use of mercury in mining, and eventually prevent the adverse health effects to human populations as well as to the environment. Thank you very much to all our speakers. And now we proceed to the open forum, and we have Marilyn Fingerhut and Liam Jen-Phuc to moderate the open forum. Marilyn Fingerhut, retired but still consulting for the United States National Institute of Occupational Safety and Health, or the NIOSH. She is the former vice president of ICOH, the International Commission on Occupational Health. She is also a subcommittee chair of Silica and TB of MinOSH. Led by Perry Gottesfeld and Marilyn, ICOH members globally have reached out to country ministers and achieved inclusion of wording in the 2018 United Nations TB resolution that commits countries to prevent exposures for two high-risk exposure groups: those who are exposed to silica dust, the workers, as well as the health workers. Liam Jen-Phuc is a medical doctor, occupational medicine specialist, a master of occupational medicine, and a PhD candidate, doctor in medicine at the Faculty of Medicine, Universitas Indonesia. He works at Prodya Occupational Health Institute International and a lecturer at the Faculty of Medicine and Health Science, UCRIDA. Take it away, Marilyn and Liam.
Hello, everybody. It's really a pleasure to be here, and I want to thank all our wonderful speakers today. Many questions have been coming in, and so what we will do now is spend about 20 minutes giving the questions to the speakers that have come in. And so I will begin with Dr. Kroll and Douglas. Two questions have come in. Do you have the first is, do you have a specific example of successful training that led to reduction in mercury? And the second is, what is the cost of the picture that you provided in the Douglas in the video of that location? What was the cost of that? So I will turn that over to the both of you. Thank you.
Thank you very much for the questions. I can maybe start with the training questions, and then Douglas could address the second question on unusual costs. In terms of the question, how training can be directly, the outcome of training can be directly measured and mercury reduction. I mean, this is a very general, or this is a very difficult topic, and I think there has been a lot of debate also in the scientific literature how just training can lead to behavioral change and risk reduction. I mean, I think this is one strategy why AGC usually does not only work with training, but also with technological changes. We usually always try that these two things go hand in hand. I think we can mainly really talk about the prevention level, where we talk, for example, about the prevention of worst practices, how training could, for example, lead to mercury amalgamation no longer taking place in settlements or in huts, where the vapors would lead to a chronic exposure of households to mercury vapors. However, again, this is also like with training, we obviously can measure the knowledge uptake and maybe an attitudinal change, but in order to really change, let's say in a reduced exposure to mercury vapors, this would require a long-term evaluation framework, which is often, unfortunately, not really part of projects. So it's really difficult. It's very challenging to say. I wouldn't be able to come up really with some numbers proving this step. However, I mean, we see in communities that increased awareness, knowledge campaigns, for example, not conducting any amalgamation settlements, etc., that they can lead to change within communities. But I wouldn't be able to present. Thank you.
Good, thank you. Okay, Douglas.
Hi. So on the cost of the equipment, again, it's very context specific. For that plant in particular, equipment was, upwards of $50,000 US. But of course, there were some unique components in there as part of our R&D, so that cost could be reduced. But the other side of the coin is all the permitting costs. So again, to establish a mercury-free system, it really depends on the rule of the land. So in Mongolia, there are very, very high regulatory barriers. ASM operations are basically subjected to the same laws of large-scale mining. So in turn, you have a tiny operation that has to assume all the costs of an operation that's 50,000 tons per day. So just to shed some light, just on permitting alone, permitting was $50,000, and a large part of that was the large-scale mining level feasibility study and the detailed environmental impact assessment. And
thank you very much, really, both of you. Thank you. You did. You contributed greatly to our day. So I'd like to turn now to the next question, and this one is for Dr. Dinjani Moyo. do you have any experience to share about the successful implementation of exposure reduction in artisanal small cell gold mining? Johnny?
I think Dr. Dingani is left our meeting. Dr. Dingani, are you here?
Yes, I'm here. Thank you very much,
okay.
Marilyn. In terms of examples of successful stories of reduction of mercury exposure, at the moment, you see, in Zimbabwe, we are still trying to put up systems in order to manage the artisanal and small-scale gold miners, particularly through issues of awareness creation within the general populace. The high number, currently there is a USAID-funded project that is looking at the health and safety of artisanal miners, but is concentrating more on tuberculosis and silicosis. But within that context, health education, awareness raising sessions have been given to artisanal and small-scale gold miners, even in terms of mercury reduction, as well as silica dust exposure reduction. But however, specifically on mercury, we have not yet had enough resources to implement such interventions within the small-scale gold mining opportunity. But yes, that will be something that is worth considering and taking up if there is availability of funding across the Zimbabwean space. Thank you.
Okay. Thank you, Dinjani. Appreciate that. Okay, the next question is for Rasmus and Peter. How many kilograms of gold are produced in these areas by using borax? There were, whoops, the question disappeared. Okay, was there any control of the gold lost in the tailings after the sluice box? And what is the fate of the plastic residue?
Let's start with the plastic residue. I think it is of no environmental matter at all in this context. But in terms of how much gold is produced, I think that in Kalinga we estimated that they produced around I think it was around 100 kilos of gold per year. And because, as I remember, they used 600 kilos of mercury, and they had before we made the intervention, they were using around 5 to 6 grams of mercury to produce 1 gram of gold. So it's of course an estimate. It's always difficult to get know exactly how much gold the miners produce. The question was whether we would see if there was loss of gold to the tailings when we do it this way. I think maybe that you can tell about that, Peter.
No, it's two different things which have been mixed up. My project in Nicaragua, extracting gold, mercury and gold out of the tailings, was not by people who used our method. It was just to test whether I could extract mercury and gold out of tailings. So I have not worked on that. In other areas, we have not tested the method to extract mercury out of tailings.
Okay.
What was that answer to the question?
Yeah, okay. And then I have another question for you all. What is the average melting temperature of gold or borax mixture?
Yeah, the use of borax in this process is that it reduces the melting point of minerals. And what we do, I have never measured and you can't see it in tables. I've never measured it. But what we do is, as you saw, was we have lots of charcoal, and that gets burning, and then we have a blower, sometimes a gas, to get it running, and then gradually the whole thing melts. I have no idea of the temperature. I just know that it works.
But what
Okay.
we can add, actually, we can add that it has been an obstacle in some of the project areas, especially in Mozambique, where they were very, where the miners were very poor mining communities, and they could not afford a blower, and they need some kind of blower to get the charcoal to heat up to the temperature that is needed. And eventually we found out a local solution. They made a blower of an old bicycle and something, and it worked. So the equipment needed is you need a blower and charcoal in order to get the temperature that bit higher to get the borax melting.
Okay, thank you. Appreciate. My next question is for Mukhtar. Mukhtar, when is the best suitable time to conduct the surveillance of the health impact for people living in and around mining?
Well, thank you, Marilyn. It's a very good question. The important thing is we have to monitor regularly. For example, we have to monitor the environment as well as the health monitoring. For the environment, we should monitor at least 1 year, and then we have to consider if there is some modification or some progress of construction or process. So we have to make sure that the exposure can be controlled as early as possible. And the health effect should be monitored necessarily based on the result of environment monitoring. Yeah, thank you, Marilyn.
Thank you, thank you. And the next question is for Paul. Do you have studies on mercury effect in fetus and children arising from mining? Do these effects, if any, remain in their lifetime? Can it be mitigated once the mercury has entered?
Paul, you're still mute.
Paul, it's not loud enough.
Yeah, I'm here. The exposure in the Faroes is not due to mining. It is entirely due to oceanic pollution, pollution in the sea mammals, the pilot whales, for example, seals, and that is the reason for the high exposure. So we have done I must say here, quite a successful campaign in order to bring down the exposure, because we have asked the pregnant women over the last 30 years to reduce their intake of traditional food, and they've done so, and which has meant a reduction in prenatal exposure of a factor of 5 to 10. So that has been, from a public health point of view, quite successful. But we have no mining issue in the Faroes. It is only dietary from the big ocean. So this is the international pollution coming to us in the Faroes, we can say. And of course, the mining activities are a part of it, as said before. Both the coal burning and the mining is big contributors to our problem in the Faroes.
Okay. Thank you. Okay, and the next question is for Dr. Kroll and Peter and Rasmus. Is it possible for a local mining organization or a group to apply for assistance from Diagolos or AGC so that they can apply mercury-free method?
Should we start answering again? Yeah. Yes, so you can, you're welcome to apply. We're welcome to take contact with us and or write us an email, and perhaps we can set up a project with you. But it's not like Dialogos have money on our own. write up projects with local partners and apply for the Ministry of Foreign Affairs in Denmark. So it's a long process. It's not, but yes, you are very welcome to contact us, and we are very interested in sharing our experience.
And I can add that just two or 3 weeks ago, I was contacted by a geologist working on small-scale gold mining in Nicaragua, and he had read what we have been doing, and he asked whether we could try to get projects financed. And we were actually starting to write a project proposal for the Danish government and for other organizations. But unfortunately, it's on hold because the president has asked all foreign organizations to leave the country within 72 hours. But I'm sure that when that ban is over, that's after the election, then we will do a big job funding this guy.
Thank you. And Dr. Kroll?
Yes, for us, it's a very similar process also as an NGO. So the HEC does not have direct funds that they could allocate to a project, but we would have to apply for a project. But our projects get funded by a variety of funders. So there's also that opportunity to reach out to us, and then we would see what might be the best feasible process to proceed.
Okay, thank you. And that is the last question. And I want to turn this back now to Eric Jors to take over. And thank you very much to the speakers again.
Thank you, all speakers.
Thank you so much to all of you who have participated here with super presentations, being good listeners, and posing your questions that have been answered. Many of them has not been answered, I know, but I'm sure that if you approach us by mail, we'll try our best to answer the questions that you have not received an answer for. During this webinar, there was an announcement from Uganda that the third MinOSH conference will be held in Uganda in September 2022. So I hope many of you will join us in Uganda. I can also say that we are going on with these webinars, and they will be announced little by little when we are ready. I think our next event will be in October, where we'll join the National Conference on Occupational Health and Safety in Indonesia and have a slot where MinOSH can present our stuff. So thank you very much to all of you. It has been a real pleasure, and I'm glad that you attended this webinar. Thank you so much. And with these words, I can close this second webinar of MinOSH. Thank you.